Hello, I'm Evie Jessen, and I'm going to introduce to you today the extraoral and intraoral examination. Assisting me today are 4 dental hygiene students. We have Diora, we have Nicole, our photographer, Margarita, and Matthew. And they'll be working with me to show you how to do all the components of this extraoral and intraoral exam. The first thing we do is we look at the client. We assess the client. We look to see, are the eyes drooping? Is there any paralysis? Can we see any problems? And I see that Diora looks fine today. So the first thing is the extraoral examination. And the extraoral examination involves the orbital and nasal regions, the infraorbital and zygomatic regions, the buccal regions, oral and mental regions, anterior and posterior cervical regions, submandibular and submental triangular regions, anterior midline cervical regions. So we're going to begin the extraoral exam, and to do the extraoral exam, we either can do it with treatment gloves or over gloves. So I'm going to be putting on over gloves. If you use over gloves, it is far cheaper than to use treatment gloves. So the first thing we do is, again, we look at our client, and she looks quite healthy. Everything is symmetrical. There doesn't appear to be any swelling. And we're now going to start with the extraoral examination. The first thing we do is we go right here at the top of the forehead, and we begin to palpate. We are looking and trying to feel for any swellings. And then we go down and we go behind the ears, and again you're looking for and trying to feel for a pea-size area, any swelling, any movable or hard nodules. Don't forget, start here and work in front, the preauricular, and then work behind, which is called the postauricular. So we're now at the postauricular. I'm looking to feel if there's any nodules. And then I go in between in the ear area, making sure there are no lumps or bumps. Okay? Always start in the midline and work out and down, preauricular, and then postauricular. Then you work here at the bridge of the nose and feel. There are many times we find cysts here in the upper mandibular or maxillary area. Okay, so work all the way down. So one more time, start here and then work all the way down. Feel any lumps or bumps right across where the sinuses are. Okay, then ask the patient to open and close. And as you observe, one more time, open and close. Look to see if they click. Sometimes I do it from the back as well. Look, listen, and feel. Look, see if there's a shift. Listen for the clicking and feel for any popping. Okay, and then we would recall within normal limits. So we've done the head, the supra area, and now we've done the sinus area. Okay, now the next area is here in the mandibular. Look and see if we feel any lumps or bumps. Okay, now we ask the client to turn to the right and then we or left, and we feel in front of the sternoid mastoid muscle. And then we ask the client to turn this way, and we feel in front of the sternoid mastoid muscle. One more time, we go behind the posterior. You can do it together. So you could do this one and then this one. Okay, and then the other side, this one, and then behind the sternoid mastoid muscle. Okay, and then we do all underneath. Palpate with all the fingers, again, the submandibular, submental area. So I don't feel anything. So we've done, to review, we've done in front of the sternoid mastoid, behind the steroid and the submandibular submental area. Okay? Now, the next thing is we're going to do the thyroid gland, so you feel in front, but the easiest way is to have the client take a drink of water and feel as they swallow. Okay, so this completes the extraoral exam. So now I'm going to remove this and we will begin the intraoral exam in 1 minute.